Hi, my name is Olivier Ferlatte, and I am an assistant professor at the School of Public Health of the University of Montreal and a research scientist at the Centre de Recherche en Santé Publique. I am the principal investigator of a new community-based research initiative that I will share with you today called ChemStory, a podcasting project to spark conversations about chemsex and HIV prevention. Chemsex, also known as party and play or P&P, describe the use of specific substances, particularly crystal meth, but also GHB and ecstasy, to facilitate, initiate, prolong, and intensify sexual encounters among gay, bisexual, and queer men. A growing body of behavioral research indicates that chemsex is one of the primary contemporary drivers of sexual risk behaviors among gay, bi, and queer men, significantly contributing to the elevated rates of HIV and STIs among this population. More so, chemsex has been found to be associated with poor ARV adherence among gay and bisexual men living with HIV. Reports of adverse mental health outcomes, such as depression and psychosis, are increasingly described in the literature, as well as reports of chemsex-related substance use disorders that can have devastating consequences on gay, bi, and queer men, including loss of employment, loss of social connection, body image issues, and overall physical health degradations. The harms associated with chemsex have resulted in significant concerns expressed by healthcare providers, public health officials, researchers, community-based organizations, and the gay and mainstream media. Recently, concerns have escalated to what some have argued amounts to a moral panic, with very sensational documentaries and news stories often calling chemsex a horror story, a death sentence, or just ravaging, leading to both a pathologization and stigmatization of the practice and of gay and bisexual men and queer men who use substances. What is more, many have noted there's community tensions about the optimal response to chemsex. Some are calling for prevention and cessation campaigns, while others are arguing for a more affirming approach that emphasizes stigma reduction, as well as harm reduction initiatives that recognize that a lot of gay, bisexual men, and queer men derive pleasures from chemsex. These community tensions motivated our team to launch a new research initiative that would center the voices of men who have chemsex or have experiences with chemsex, as we felt that in the discussions and public debates surrounding chemsex, the voice of men who have chemsex experiences were not always heard or even present, nor is the perspectives of men who do chemsex well described in the scientific literature. With the exception of a handful of qualitative inquiries, research on chemsex have largely prioritized biomedical forms of knowledge production, which have played an important role in producing overly individualized understandings of chemsex. With a desire to put forward these voices, our team turned itself towards art-based research. To our knowledge, art-based research have not been used to study chemsex thus far, but this class of research has many advantages for the study of complex issues. Particularly, art-based research limits the control of the researchers about what is shared and discussed by privileging participants' viewpoints. It can bypass as well the awkwardness of traditional interviews or questionnaire that can feel like an interrogation or just probing in the personal life of the participant. More so, art-based research offers very innovative mechanism for knowledge translation and community-based intervention, because what is produced by the participant can then be shared with the community as well as with healthcare providers, with policymakers and the public. And finally, art-based research can be very transformative. It can permit participants to gain insight about their own experience and can be empowering as they feel they are working towards a solution on an issue that they feel is important to them. To date, photo voice has been the main art-based research method adopted in HIV research, but our team decided to turn itself to podcasting. Podcasting has not been explored as a research method despite its increasing popularity in critical pedagogy, mainstream culture, and as a form of self-expression. A podcast, for those who don't know what it is a digital audio file made available on the internet for downloading to a computer or mobile device, typically available as a series, new installments of which can be received by subscriber automatically. Podcast is portmanteau for iPod and broadcast. Podcasting started as mostly an independent way for individuals to get their message out there and build a community of people with similar interests. That form of podcast still exists, but there are multiple forms of podcasts now. Companies are producing them, radio and TV network as well as comedians, storytellers, and much more. There isn't a predetermined length, format, style, production level with a podcast. They are extremely growing in popularity. There are over 47 million podcast episodes available on the web as of March 2021. In the US, 37% of Americans have listened to a podcast in the last month. They are also growing in popularity in gay culture with podcasts such as Query and Getting Curious, and are increasingly used in Canada as well to explore complex issues of mental health and addiction. I'm thinking about Crackdown or stories like Crazy. Podcasts offer many advantages that could benefit CBR in the field of HIV research. They require little infrastructures and equipment to produce, are highly engaging, and can be disseminated broadly through many platforms at low cost. Drawing on other art-based methodologies and our team's collective experience in CBR and HIV research, we decided to explore a new research methodology using the creation of podcasts by community members so that they can share their perspective and experience with Chemsex, with the community and healthcare providers and policymakers. This is done in collaboration with knowledge users, people with lived experience, and an expert in podcasting who was hired for the project. Together, we have designed a workshop series of 3 workshops of 90 minutes each that are designed to prepare individuals to record a short podcast of between 12 to 15 minutes to share an aspect of their experience with Chemsex that they want others to know. The first workshop is a chance for people to get to know the project, what we want to do, get acquainted with what is a podcast, and learn about the different trends and formats such as the interview and the journal format. The second workshop, we discussed the ethical challenges of doing a podcast around sensitive topics such as chemsex. Discuss how one can find how to share, what message they want to share, and how to find their voice. And then the participant also learn how to build a creative plan. Then the last workshop is dedicated to the technical aspects of podcasting, such as recording and editing. Throughout the workshops, we also have discussion of Chemsex and of why is it important to kind of share stories about it. Earlier this year, we launched a recruitment for participants through multiple strategies, including recruitment via community-based organization, as well as through social media. We are trying to recruit men with a diversity of experience with chemsex, including men who still engage in chemsex, men who have stopped, men who have struggled with addiction, men who have not. Of course, due to the pandemic, we are conducting these workshops completely online. We're using Zoom, and we decided to cap the number of participants per workshop to 5 to keep the group intimate, considering that there's also 2 researchers present and her podcasting expert. We are still in the process of doing these workshops and having men produce their podcasts. Her next step include an evaluation of the project. Since community-based podcasting has never been used as a research methodology before, we're really interested in learning about the experience of the participant. We will soon expand the project to English to produce podcasts in English. And then we will also disseminate the podcast soon into a series on our website as well as on podcast streaming platforms such as iTunes and Spotify. We're really hoping to educate the public but also healthcare providers and the queer community on this issue and perhaps broadening the scope of understanding between the relationship between drugs, sex, pleasure, and harms. I'd like to thank our funders, CIHR, as well as our community partners, Réseau, IDQ, and CBRC. Thank you.